And next on Arizona Midday, many women want bigger breasts, but they want to stay natural too. We're going to tell you a new procedure. Welcome back, everyone. Do you want to up your cup? Well, many women want breast augmentation, but aren't sure if it will look natural. Well, Dr. Todd Malan from Innovative Cosmetic Surgery Center says he can make it happen. He joins us now along with one of his patients, Gina Taylor. Thank you both for being here today.
Thank you.
All right, let's talk about the new way to perform a breast augmentation.
Well, for years, women have asked me when we've performed liposuction, can't you just take the fat out from down there and put it up here?
Oh, yeah, I've heard that a lot of times.
Well, they have tried that in the past, and the methods that they've used in the past have just not been very successful. Typically, the women would end up having the fat transferred in, and they would lose a large quantity of that fat because the fat just wouldn't survive. So we now have new methods available to us that are proven methods that work very well at being able to take the fat from anywhere in the body, transfer it into the breast through small needle injections, no incisions required, and the fat has a 90% survival. So we're seeing great survival.
Tell me how it works.
Well, we use a splint such as this. This is a tissue expander or splint. That goes on before the procedure. And prior to the procedure, a woman would wear this. It would help to expand the breast to make lots of empty, open space to allow for the fat cells to survive. Then after the procedure, they would continue to wear this, and it would form a mold or a splint to help give form to the breast so that the breast has a nice aesthetic appearance or a nice form, so that as the fat's surviving, as it's starting to ingrow and survive, it has a chance to look really nice.
Now, what about stem cells? How does that play into it?
Well, normal human fat has a large quantity of stem cells. And the problem has been in the past that the way that we extracted the fat would damage those stem cells. But the new extraction methods that we use, we're able to keep the stem cells alive so that they're able to stimulate new blood vessels to grow in the area. They're even able to stimulate new fat cells to grow, so that we're able to actually get real good fat survival.
Now, how is it different than implants?
Well, with an implant, of course, you're using an artificial substance that goes under the muscle typically that tries to recreate the fullness of a normal breast. A normal breast is mainly made of fat anyway. It's 90% fat. So it's trying to recreate what a normal full breast full of fat would look like. But what we're actually doing is we're really truly recreating what a breast would look like if it were larger, with actually putting your own fat back into the breast and giving it that full natural appearance.
And like we were talking about, it's lipo and breast augmentation in one.
Yes. So
a lot of women will not complain about that.
No.
Gina, you recently had the procedure. What do you think?
I love it. You know, I work out a lot, and for me it just works for my body and my lifestyle. And I'm 40, and gravity sort of takes over. I have had 2 children, and since surgery, I have never looked better and felt better. And it's amazing.
Did you feel that it's more natural and a more natural way to do it?
Absolutely natural. Absolutely. I mean, there's nothing that feels strange on my body at all. It feels amazing.
Now, doctor, who's a candidate and what's the cost?
Well, a candidate is anyone who desires to have breast augmentation. It is a viable opportunity for someone who's never had a child before, or especially for women who have had babies and have a lot of empty space in their breast that needs to be filled in with that fat. Cost-wise, because we are adding liposuction with the breast augmentation, it does take quite a lot longer than putting in a normal implant, so it is more expensive. But when you compare the fact that you're also receiving the benefits of liposuction and the augmentation, it's actually cheaper than doing the 2 procedures combined.
Well, thank you both for joining us today.
Thank you.
Thank you.
All right, and for more information about this procedure, you can contact Dr. Malan at that's drtoddmalan.com. You can also call the number on your screen.